what I do is I teach kids, and a lot of kids come to me and they have stories inside of them that haven't been valued, and at the same time they're yearning for something to feel passionate about. My job is to try to pour out those stories and to make them feel valued, while at the same time give them something where they find value in what they're doing. So we do that in cooking, we do that in the garden, we do that in taking care of chickens, we do that in talking about how to create community, and then show them how to do that through cooking pancakes and kneading them together, and then that leads to conversations of what is the definition of community, what is the definition of family, and how do we take care of those. And it turns out that a lot of those conversations in the garden or around the table lead to the concept of health, because health leads to happiness, and happiness leads to becoming a whole person and keeping those people around you whole.
I'm excited to say that at the University of Louisville, there's tremendous support for our LGBT Center, and one of the ways that we're making Louisville a healthier place is that we're helping to train our next generation of healthcare providers in our School of Medicine, Nursing, Dentistry, and Public Health to be able to understand the needs of the LGBT community and to respond appropriately to the healthcare needs of that part of our community.
First of all, the primary piece that I do is violence prevention. And I think, and I'm kind of glad that we've started to treat violence as a disease or as some medical disorder. Because I see over the last 30 years, so many different kinds of addictions that are associated with violence, including just addiction to the lifestyle.
I think what's really important is that people need to not just look at health as like you and your doctor. Going for a walk, or going swimming, or spending time with your grandkids, spending time by yourself, journaling, whatever it takes for you to just feel better, then do that. And it doesn't have to be a big thing like I'm gonna find the cure for cancer. Probably not, but you can go for a walk.
A person as a whole needs not only spiritual, physical, intellectual health independently, but all of them together. We should look at the body as a whole.
Anyone can do anything to make their community better in a good way. You don't have to start up a huge program and educate people. Just go out there, like Sadia said, just go out there talking to your neighbor. Make a lemonade stand, start talking to people about what you do. Just make people feel better. If you're better and another person's better, it makes the community better.
So on Monday, we all went out and we planted 45 trees on campus. And we said, all right, that's something simple. We got dirty, we put something into the ground. And then we started to look, what is the long-term impact of this? And it's through doing those small, simple acts on a daily basis, whether it's planting a tree, whether it's recycling, whether it's learning how to compost, whether it's cooking a meal at home for somebody else, whether it's opening a door or carrying a bag for somebody, or whether it's just starting a conversation in a way that makes a person feel connected. Those are all things that lead to physical, mental, and community health that anybody can do.